My name is Deborah Carvalho Malta. I am professor in the Federal University of Minas Gerais, and I am professor in public health and epidemiology. The NCD action plan in Brazil was launched in 2011 because the NCD is the most important problem in public health in Brazil, responsible for 75% of the deaths. Then we organized one plan in Brazil that focus in the main chronic disease, cancer and cardiovascular disease, diabetes and chronic respiratory disease, and focus in the risk factor. We have a partnership with the Glasgow University to monitor the progress of in NCD. We have several inequalities in Brazil, and we have the worst indicators in the poor populations. Then it's so important to monitor the progress in Brazil in NCD and risk factor related to different populations.
I'm Mauricio Barreto. I'm a professor at the Federal University of Bahia and a senior investigator at Fiocruz, Oswaldo Cruz Foundation. Live and work in Salvador, Brazil. In the moment, I'm director of CIDACS. CIDACS is a center of data and knowledge integration for health. Is a kind of experiment in some sense that was created with the mission to try to explore the potential of the large data sets that are produced in Brazil. And through the integration and the linkage of this data set, to design large studies, that can answer important scientific question, using this database. 100 million cohorts is one of these products of CIDACS and the linkage of data. In Brazil, there is a lot, as other countries, a lot of social protection programs that people have shown that this program has effect on health. Then appeared the idea to using databases in Brazil that compile more than 100 million people, near 60% of the Brazilian population is under this registration. And you use this register as the baseline of a large cohort where you can study the effect of the different social protection programs on health.
I'm Alastair Leyland. I'm the Associate Director of the MRC CSO Social and Public Health Sciences Unit and the Director of the NIHR Global Health Research Group on Social Policy and Health Inequalities. This week we've had a team of researchers here from Brazil, 12 Brazilian researchers and 4 researchers up from the London School of Hygiene and Tropical Medicine, working on the project to have a week of face-to-face meetings. The project is about looking at the impact of certain welfare policies in Brazil on health. So 2 large policies, one a small payment made to families on condition that children are kept in education and taken for regular health checks, and the other a large housing program. And these, because of the size of the country, have required considerable investment. So we're looking to see what benefits the population of Brazil have received as a result of this. And looking forwards, we'll see what other countries, both lower and middle income countries, but also developed countries, can learn from the Brazilian policies. I'd like to say a huge thank you to the team from Brazil for coming over, for making the long trek to Scotland, and for working so hard on the project, not just during the week, but in general, but also for the great support we've had within the unit to ensure the week went smoothly. Thank you.